As we come on the air tonight, several Central Georgia hospitals report they are busy, overcrowded, or dangerously overcrowded. That's according to the Georgia Coordinating Center.
Hospitals and emergency medical services use that site to decide where to send patients. It lists Piedmont-Macon as dangerously overcrowded. They say one reason is the increase in patients coming to their emergency room with the flu.
The CDC says Georgia has some of the nation's highest flu numbers. Jessica Cha spoke to some Central Georgia hospital representatives about how the flu is affecting them.
It feels like everybody knows somebody who's sick.
At least 10. Fevers, coughs.
You hear a lot of people that's in the hospital. I had one to go on Christmas, but they're out now.
It's flu season. Atrium Health Navicent Chief Medical Officer Patrice Walker says it starts in the fall and usually ends in early spring.
And that's going to include flu, RSV, and of course COVID.
Walker says they're seeing it in their hospitals.
Based on general, volumes in our emergency rooms and our urgent care centers, I think that we are seeing increased numbers.
But she says that's normal. They just get busy.
This is the time of year when we just tend to see spikes in the transmission and infection of these viruses.
Piedmont Hospital says they're busy too.
This year certainly no different.
But Piedmont's Associate Medical Director Jason Buckert says what's different is this year's flu numbers.
Severity and the acuity is pretty high this season, and what we're seeing now is that flu is kind of coming back to what it was in the pre-pandemic times.
Buckert says when people with pre-existing conditions get the flu, they often have to be admitted.
And so what we see is that the hospitals do get full, and that's definitely what we're experiencing.
It's a domino effect. When rooms fill up, that backs up the emergency department.
We feel the strain as far as the staff, and then on top of that, we get sick too.
Buckert says the higher flu numbers could be fewer people getting flu shots, or it's mutated to a more severe form. Walker and Buckert says it's not too late to get your shot to stay safe. In Macon, Jessica Cha, 13 WMAC News.
The CDC reports during last year's flu season, about 47% of U.S. adults got the flu shot.
Buckert says if you are feeling ill, go to an urgent care. That's really a good first choice instead of a hospital. They say you should come to the hospital if you have chest pains or trouble breathing.